Success against the spread brings calls to reopen. Joining us on Columbus on the Record this week, Laura Bischoff, State House reporter for the Dayton Daily News, and Julie Carr-Smythe, State House correspondent for the Associated Press. Welcome to Columbus on the Record. We have a different look, but the same good information. This is the position where Ohio leaders find themselves this week. They acted early and aggressively to slow the spread of a deadly virus. Ohioans complied with stay-at-home orders for the most part. 750,000 of them suddenly lost their jobs. But it seems to be working, slowing the spread and saving lives. But now that the worst fears are not coming true, calls to grow and reopen Ohio are coming. They want to get people back to work, back to normal. Governor Mike DeWine says, not just yet.
We're not going to keep this on one day longer than we have to. Once we can start moving it out, we're going to do that. We're going to do it in an intelligent way that will enable us to get out of it, but also we're going to do everything we can so that we don't have a respike, so we don't have it coming back.
Ohio has nearly 6,000 confirmed cases of coronavirus, a number that is likely low because of the limited testing. Coronavirus has put nearly 1,800 people in the hospital. 227 Ohioans have died from COVID-19. Laura Bischoff, where are we into this? We're about a month into it's been about a month, 5 weeks since we shut down the Arnold when this whole thing began. Where exactly are we as far as coronavirus's toll on Ohio?
Well, the aggressive and early action by Governor DeWine and Ohio Department of Health Director Dr. Amy Acton really has kind of smushed down that pandemic curve. And so it'll be smushed down, but it'll also be spread out. And so I think that it's going to take a little while longer for us to kind of get through this first wave. It's yet to be determined whether or not we'll have subsequent waves of this. But I would say we are still on the earlier end of things. I think we're still on the upslope, but we're not taking, as the governor said, we're not taking off like a rocket on that slope anymore.
Yeah, it may not be too huge a wave, actually. Maybe it's more of a swell. I hate to use these metaphors, but that's what we're looking at right now, correct?
Yeah, it seems like the way they're drawing the graph now is that it's a long, kind of more like a long hump to get over.
So Julie, did they were the predictions too dire at the beginning? Or have we done that good a job in staying home? Because we really, over the past 2 or 3 weeks, we haven't done a whole lot extra to stay home. The stay-at-home order came into effect. Some businesses are allowed to open, most closed. Bars and restaurants closed even before the stay-at-home order. I don't sense that we've done a lot extra in the last couple of weeks, but the picture is getting much rosier. What happened with those first predictions?
Well, the predictions were they would have spiked much sooner. In fact, there's a little bit of a question. I think the jury's still out on this in the modeling and what would have happened and could have happened. I don't know that we can know that right now, but certainly the fact that we took these actions, as Laura said, has caused has really helped us to be one of the leading states in the country in holding this down. And I think that it's slow and steady, as the governor and Dr. Acton have continued to say, that we haven't done anything new, but we've persisted with what we are doing. We're not lifting any of the restrictions yet, and we've kept them in place for longer than many states.
So the calls to reopen the country, really, we're hearing all around the country, but here, because we're doing so well and we aren't seeing the 10,000 cases a day, which was predicted just 10 days ago, protesters showed up at the State House this week carrying signs saying, "Open Ohio now," or "My rights are being infringed upon." Laura, how much pressure is the governor and his administration on to start to reopen the state?
Well, I think it's going to be mounting pressure. You have 700,000 Ohioans who filed jobless claims. It's really historic. You're hearing more from state lawmakers who are kind of questioning the wisdom of keeping these orders in place much longer. saying it's time to start talking about reopening Ohio. And, you know, it is interesting that the models, they were really dire in the beginning. It's improved quite a bit. And I think that Julie's right. Like it's the action that we took early and aggressively that changed the look of the model. And these models are, you know, when you think about it, we haven't had a pandemic in 102 years. And this is an instance where everyone is susceptible. There's no vaccine available. It's got a high transmission rate. So really the only tools that we have are the same ones that we had a century ago, which is stay home, quarantine, wash your hands. And, you know, fast forward 100 years, the modelers don't know exactly how much people will abide by these orders, you know, they really kind of are doing a lot of estimation on a lot of different things, like how much people interact with each other, how much they interact across the state or just within their own communities. All that's, it's really, from what I'm learning about modeling is it evolves every day. You update it every day with new data to reflect what just happened.
And
Right,
Julie,
Mike.
go ahead, Julie.
And I think that in Wuhan, China, you know, at the beginning, we were using modeling that was based on what had happened there or what had happened in Italy, for example. And not all those things are going to apply because as Laura says, it really has to do with whether or not you are, how much the public is buying in, and you model to say, well, we're going to have 100% buy-in or we're going to have 0% buy-in, but it's somewhere in that mushy middle that is where actual behavior comes.
And the fact that we started really almost a week earlier than other states. I mean, you look at when it was March 3rd or 4th when they shut down the Arnold. And I think I've seen stories that Louisiana and Ohio had their first case on the same day. And Louisiana did not have the same shutdown orders that we had, and their totals have been much, much higher, deaths and cases as well.
I think that the decision about the Arnold was really pretty groundbreaking. And I remember Laura and I both sitting there that night till it was 5, then it was 6, then it was 7, and them trying to work out that deal because it was unpopular. It was economically devastating for Columbus. That's its biggest event, moneymaker of the year. And so, but it, you know, it was going to fly in people from 60 countries into a very closed environment.
I mean, that was our Mardi Gras, basically. Not quite the same scope as Mardi Gras, but bringing all those people in from elsewhere and then sending them back out.
It's our Mardi Gras with less drinking and more muscles.
That's right. The fewer beads and all the other stuff that went along with that as well. Getting to the cases, it's still, and you can hear it when you hear it. Listen to Dr. Amy Acton, the director of the Ohio Department of Public Health. We are testing 0.5% of Ohioans to see if they have coronavirus. So it is just, the number is almost, it's not completely meaningless, but it's close, correct?
I would say yes. I mean, it was very narrow to healthcare workers and also skewed toward those who were assumed to have it or had been exposed. And so it makes it difficult to use in terms of predictions.
Laura, you wrote this week about how hospitals are preparing for this. Are they prepared? Are they being forthcoming? Are they cooperating? What's the bottom line? We're thinking now it's going to be better than we feared, but are hospitals ready?
Right. Well, you know, the governor announced that there's going to be convention centers across the state used as kind of pop-up hospitals for COVID patients who are recovering or aren't as seriously ill or as acutely ill. I don't know how many of those beds are actually going to end up having to be, put in place really at this point. Because I think that the curve is long and steady rather than a giant roller coaster ride. The Ohio Hospital Association has developed a 54-page document that kind of described in the event that there are scarce medical resources, that we don't have enough PPE, that we don't have enough staffing for everybody who's acutely ill, that we run out of ventilators. He kind of some guidelines on how those things should be allocated. And each hospital is also working on its own plan. This is not an Ohio plan. It's not one that all the hospitals have adopted. So it's kind of interesting because then it kind of raises the idea or the prospect that if we were overrun, which maybe that's not going to happen, but if we were, would Ohioans face kind of a patchwork of, policies for who gets a ventilator and who doesn't, and who's scored this way and who's scored that way?
Yeah, I mean, would a hospital in Cincinnati share its equipment, its staff even, with a hospital in Toledo? Because they're closer to Detroit, where they have perhaps more cases, because Detroit has had a lot, Julie.
Right. I think that, and this is something that's happening all over the world in a lot of settings, obviously, but the idea that former competitors are going to need to pull together and cooperate. And this is, really the showcase look at government working well, because government comes in and sort of helps make some of those relationships work and oils the gears of those so that the resources can be used in the best way possible.
Dr. Acton said this week that she thought that maybe we would be able to shift equipment to hotspots within like nursing homes or certain outbreaks, or even within prisons, so that we would have enough ventilators to be able to just kind of move them around the state, which is really quite a different story than hospitals hoarding equipment just in case they need it.
Yeah, that was encouraging news. The economic toll is incredible, as we've talked about already on this show. 226,000 Ohioans have filed for unemployment just last week. That brings the 3-week total to nearly 700,000 people. It's been a Herculean task to handle all of these claims. Computer servers and call centers were not set up to handle 20 times the normal volume. Understandably, people who lost their jobs and must pay their bills are very frustrated. Officials say they are starting to get on top of it. Checks are starting to go out. Correct, Julie? What is the status with unemployment? Are they getting a handle on it?
I think they gradually are, yes. And what the lieutenant governor says, who's sort of overseeing that operation, is that, every day he's taking concerns and questions that he's getting and fine tuning and improving the response system. I know they've also hired a lot more people to answer questions and diverted them to this onslaught. So I think that gradually it's going to get better, and they're assuring people there will be money there, which is sort of amazing in itself. Yeah. Because it's going to be very expensive.
And the money goes back to when was first unemployed, not when their claim was processed. So they may get a big check for the first month that they were unemployed, not just start that on that one day when it finally went through, right, Laura?
Right, that's true. But the tricky part is that a lot of Ohioans live paycheck to paycheck, and to be suddenly thrown out of work and not be able to file that claim, and they're having a lot of people are having a difficult time trying to bridge the gap between their last paycheck and the promise of when these unemployment benefits are going to start flowing. This is particularly true for 1099 workers. These are independent contractors and gig workers. A lot of hairstylists work under those circumstances. And it's just, I was talking to a gal down in Wilmington who just said, she had to borrow money from her mother to put groceries in the house. And she would like a more concrete answer from Ohio. When are the checks coming?
Yeah, and they're trying to merge two systems, because Ohio's handling the unemployment checks, but then there's money coming from the stimulus bill that was passed by Congress, the extra $600 for folks to help them get through this because of the suddenness of this, Julie. So they're trying to merge these two systems.
Right. And I mean, this is a case where, I just spoke fondly of government when it works, but these are giant bureaucracies that one's federal, one's state, they don't necessarily work together. And everybody is waiting in different parts of the system for the money to flow properly. And meanwhile, as you started out by saying, it's just an inundation. It's so many people, and it's not just in Ohio, it's all over the nation, just exploding unemployment. I think we're at 10% now or 20.
Yeah, it's incredible. This week, the governor mentioned that they are starting to get to work on a plan to bring Ohio back. Seems kind of odd to be talking about that because we haven't hit the peak yet, but I suppose we should start talking about, okay, how do we go about reopening the state's business? Do we do it all at once, Laura? Or is it going to be like reverse of what we did?
No, they said that, we gradually moved into these steps and they'll be gradually unwinding what we've already done. Some of the things that they've talked about is that there has to be an adequate supply of personal protective equipment for healthcare workers in hospitals and nursing homes and also in prisons so that they can deal with outbreaks. There needs to be a steady decline in the number of new cases that we see each day. And there also needs to be wider and bigger capacity for testing. They've been talking about having these serological tests, these blood tests where they're in development. They're not quite here yet, but essentially you go and get your finger pricked and they would do a rapid test to determine whether or not you actually had COVID. Maybe you were one of those people that was asymptomatic or it was just, a very light symptoms. But it would show whether or not you have the antibodies and immunity so that you would be able to safely go back into the workforce. They're not sure how long this immunity might last. It's really, it's a brand new disease. So a lot of those questions can't be answered just yet, but that's one of the criteria that they want is widespread testing and be able to test outbreaks as they happen and then contain them so that it's not, you just quarantine those who need to be quarantined rather than everybody.
So how would that work? I mean, you go in and it's like an insulin, you get a little prick on your finger, you could test almost immediately that you're either immune or you're not. If it comes out that you have it, do you have to stay home for 2 weeks and they contact all your friends and family and they have to stay home for 2 weeks? Is that how it worked, Julie? Do we know yet?
Well, we don't know. This actually just came up here Friday, and we're the medical director is saying that this test is being invented essentially before our eyes, and we're trying to figure it out. But clearly, you would not allow those who are infected to come in, and you would have to have provisions for that. Like the lieutenant governor was saying that, he is working with businesses on sharing best practices of what's happening now at business sites to keep places sanitary, and that he will try to maybe share those around the state, like we were talking cooperatively. And also, Larry Householder has put together, the Speaker of the House has put together a panel that's looking at the economic piece of this as well.
Yeah, that's the next thing. What can the state do? The state has to balance its operating budget every year. It can borrow for capital projects, roads, bridges, and water pipes and sewers and things like that. But it has to balance its budget every year. Income tax revenue is way down. Sales tax revenue is way down. It's going to be a painful budget year. Suddenly, we never thought we were going to see this, and all of a sudden, the fiscal year end is approaching, and it's going to be a tough year next year.
Right. I think that that's pretty clear. The only godsend of the whole thing is that it will be the same in every state and every nation, every capital across the globe will be hitting this, and that's why it's unlike any kind of potential recession that we've seen before, because no player has an advantage over others. And so you look at it and you just feel like the whole thing is sweeping across the world, but at a little bit different time.
Any speculation, Laura, on what the budget might look like? I mean, he's asked for, I guess, to plan for a 20% cut. That was a couple of weeks ago. Governor DeWine asked agencies for a 20% cut in their budget.
Right.
Is there any talk of even a temporary tax increase, or trying to raise debt limits? Extreme case, go to the voters and say, let us have a deficit for 5 years, an operating deficit, change the Constitution even.
I haven't heard any of those scenarios. I do know that, the recent numbers for the current budget show that the revenues are already down, and that's before a lot of these shutdown orders took effect. And so there's two issues. One is to get through the current budget year, which ends June 30th. They do have, luckily, $2.7 billion in the rainy day fund. So they'll likely have to use some of that to close whatever gap we have. They extended the tax filing date to July 15th instead of April 15th. So Ohio's gonna miss out on some of those revenues that they would have had coming in right now. It'll be delayed. But next year, I think that the revenues are really gonna crater, and it's gonna be a really heavy lift for lawmakers and for the administration to be able to continue to provide services and, accomplish their goals.
Yeah, then you think about the cities that are so reliant on income taxes. I think it was a Brookings Institute that said that Columbus is, I think, the most reliant on income taxes of any city in the country. And if 80% of the city budget is police and fire, and they have to cut a lot of money, you just got to figure that's going to have a big effect on that. All right, let's get to our last topic. We're in strange times when this is our final topic, as if it's an afterthought. Bernie Sanders is no longer an active candidate for president.
So while we are winning the ideological battle, and while we are winning the support of so many young people and working people throughout the country, I have concluded that this battle for the Democratic nomination will not be successful.
Sanders left the race this week. He was done in by the sudden unification of moderates and establishment Democrats, and of course, the worldwide pandemic. Sanders moved the party to the left. He energized a core group of supporters, but that group did not grow much larger than a third of Democratic voters. Julie Carr Smyth, I guess it was kind of stunning that he dropped out, but it was underwhelming. He did it via one of these from his house in Vermont, and no rally, no supporters, no hugs from his supporters. Just kind of like, okay, I'm done.
Right. Yes, it definitely fizzled. And interestingly, his whole campaign was sort of riding along. And just when Joe Biden had kind of begun to unify, as you were saying, and begin to win a swath of these states, the pandemic came, it swept universities, which was a key area of support for Sanders, and sent a bunch of students home, distracted them. I think it's pretty safe to say screwed up voting for a lot of them because they were having to go home and live with their parents. And so the whole movement just kind of went underground, if you will. And then you're watching death tolls every day across the country. It's almost distasteful to be trying to bring down somebody in your party, if you will, at a time like that.
So Laura, where do Bernie Sanders supporters go, the ones here in Ohio? Odds are Joe Biden would have won the primary here had we held it on St. Patrick's Day or even the mail-in voting now. Where do his supporters go? Do they support Joe Biden in the fall here in Ohio?
I think that the bulk of them will go to support Joe Biden. I think there might be a slice of them that stay home. And then I think there's another slice that will actually support Donald Trump. There have been some polls that show, I think 10 or 15% say that they would vote for Trump. I think that those voters are the ones who kind of like the populist appeal that both Bernie Sanders and Donald Trump present.
Real quickly, Julie, do you think if this pandemic had happened last March and it shone the spotlight on our healthcare system and how so many people live paycheck to paycheck, that Bernie Sanders would have had a better shot? His message would have resonated better?
I think it's a great question, Mike, because these are some of the key issues. I've been speaking to some former or current Bernie supporters for some coverage we're doing, and they said that exact same thing, is that, it's really sad at a time like this that, the healthcare system is definitely showing itself to be not, all it could be. And that was one of his key issues. So I think it will definitely change the face of politics that he ran this campaign. And I also think that, in his final appeal, he said, go ahead and vote for me if you want to, because the more delegates I can take into the convention, the more our agenda can can maybe live a little bit.
Yeah, there are a lot of candidates on the Democratic ballot here in Ohio that are no longer running. There's only one left. Anyway, all right, it's time now for our weekly off the record parting shots, and we'll start with you, Julie. You go first.
Oh, gosh. Well, like I say, I think that this task force that House Speaker Larry Householder has put together is going to be an interesting thing to watch in the coming weeks, because they want to bring the economy back, or make a plan for doing that. And I think that that will be ramping up gradually, maybe virtually in the coming weeks.
And Laura.
You know, one thing we learned from the 1918 pandemic is that sometimes these pandemics come back in different waves. They had a wave in March with the 1918 pandemic, and it came back again in the fall. So the question is whether or not states will take steps to prepare contingencies for doing mail-in voting if the general election were to be disrupted. I don't think Ohio lawmakers will go for that. But I do think that there are discussions underway about doing that.
Yeah, those discussions should start now. And of course, Donald Trump said that mail-in voting is rife with fraud. Mike DeWine said it's safe from coronavirus, but he didn't take a stand on whether it's corrupt or not. We'll have to see how that plays out in the weeks ahead. That is it for Columbus on the Record for this week. Stay up to date on Central Ohio COVID-19 news by listening to 89.7 NPR News, logging on to WOSU.org, and by watching us here on WOSU. We have nightly updates during PBS NewsHour. For our socially distancing crew and our panel, I'm Mike Thompson. Have a good week. Stay apart, stay together, and stay safe.